COVID infections in the country have gone down to the 1,000 level for a second day on a Thursday. Looking at trends, the OCTA Research Group says we have finally reversed the Delta-driven surge. 7-day moving average of new infections in the country has gone down to March levels, while for Metro Manila, it has reverted to July lows. For OCTA, vaccination coverage was key.
We have seen the pattern na when it hits 40% of the total population, it starts driving down the number of cases talaga. So it was around that point. I think we were at around 40% in September when cases really started decreasing.
But the group is warning of possible upticks once again due to the waning efficacy of vaccines. They now urge the start of booster inoculation as soon as possible.
Kaya nagkaroon ng spikes in some countries, for example, Israel, after 6 months, it's because of the waning efficacy. Once the vaccines start losing their effectiveness, we might see more outbreaks. That is possible. That's why we support having the booster shots.
The government eyes to roll out booster shots by November 15, pending the amendment of emergency use authorization of vaccines. To do this, the FDA has tapped the vaccine experts panel to review all of the submitted applications for the EUA review of vaccines.
We just want to make sure that we assure talaga tayo sa safety at saka yung efficacy, yung benefit ng added dose before we give it out. But we will release it naman at the soonest possible time.
The National Immunization Technical Advisory Group recommends that vaccinees receive the same brand they had during their initial doses.
We really have to ensure the science of it all. While it's true, people will argue that, we need it, otherwise we're going to get sick and so on and so forth. We want to make sure that at the end of the day, we are doing the right thing rightly.
The Interior Department says the National Vaccine Operations Center is already ironing out the guidelines for the first rollout of booster doses. Phase 1 will be for 1.5 million health workers, followed by Phase 2 for 4.6 million senior citizens. For News 5, Greg Gregorio, we are One News.